Hi, everyone, and welcome to Ask the Blood Detective. For those of you new to the show, you must know one thing about the Blood Detective approach. I get right into it. I talk about nutritional chemistries, how to interpret blood work, because after all, I am the Blood Detective. Yes, it is a self-proclaimed title in a sense. I had mentioned on prior shows that I was working with a woman who had a devastating, mysterious health problem for years that I was able to diagnose and successfully treat her quite naturally as well. And she said to me that I was her blood detective or something very similar. And the name stuck. And ever since, I've been using it as a sort of call to action. You know, being a detective means that I'm going to dig deep, trying to find the truth about things. And that's what we're going to do. For those of you who want to make comments or to get me a message, you can do that by emailing me at info@blooddetective.com. That's info@blooddetective.com. That's where you want to send your show ideas and all comments. If you want to work with me, you can call me at 914-552-1442. And for additional content on all sorts of natural health and medical topics, you can go to my website, which is drmichaelwald.com. That's DrMichaelWald.com. All right, let's get into today's topic, which is long COVID. So I think by now it's been roughly 3 years or so since the United States had begun facing this pandemic. And one of the unexpected side effects, you might say, of the coronavirus is what's known as long COVID. And it seems that it's already quite a mystery as far as medicine's concerned. I also want to let you know that I'm writing a book, which is tentatively titled Long COVID, The Natural Treatments. So I expect that book will probably be available to the public December of 2024. So look out for that. You know, when we use the term syndrome, that usually implies that there's lots of different aspects to this so-called malady that we're facing, and we haven't narrowed it down yet. But just because we may not have narrowed down exactly what long COVID is, it may not even be what it is. It may be many, many different things. But we do know that it seems to be associated with coronavirus infection. It may also even be associated with coronavirus inoculations or vaccinations. We don't know. We're going to eventually find out. So this so-called syndrome results in long-term fatigue, and people complain of brain fog. And usually they'll do that post-recovery from an acute infection with coronavirus 19. And the long-term fatigue and the brain fog seem to be the most predominant symptoms. But from the research that I have done and in my clinical practice, I can tell you that there's more than 200 distinct and varied symptoms that have been reported, presumably due to long COVID. I should also mention, and I'm going to reiterate this as we go along with the show, is that it seems that the cardiovascular systems of many people who are infected with the coronavirus seems to lead to long-term cardiovascular symptoms. We're talking strokes and heart attacks, and also microclots, and even inflammation of the covering or sac, what they call the pericardium around the heart. And I want to emphasize too that, you know, I've had individual patients with long COVID that have had completely different expressions of disease. So there's many factors involved in a person's susceptibility to COVID, what long-term side effects they will experience, and their overall outlook. So let's review, given that, you know, how do people get long COVID in the first place, and who's at the highest risk of developing long COVID. And these are the types of things that if we have some leads as to who is more susceptible, we can obviously change our lifestyle habits to mitigate or to reduce our chances of, number one, getting long COVID in the first place and recovering and actually using our convalescence during COVID illness to actually improve our health and well-being. And I think that's where the nutrition part comes in. Now, sadly, if you were to ask let's say your primary healthcare provider what long COVID is, that doctor will probably say something like, well, it represents a syndrome of varied symptoms that some people with COVID tend to experience for particularly long periods of time. And if those doctors are particularly adept and educated, they will say, and how these individuals with long COVID seem to present with fatigue and malaise and also brain fog as the predominant symptoms. But it can manifest, as I've mentioned, very differently in a variety of people. Then when you ask for treatments, there isn't a whole lot out there medically speaking. And in a little bit, I'm going to talk about at least 3 of the medications that may have some potential for alleviating some of the symptoms of long COVID and maybe even stopping it in its tracks in some cases. But I'm sure you will agree with me as this conversation continues that, number one, we can't rely on a miracle medicine to get us out of this one. And we know plenty about the role of nutritional and natural methods to mitigate viruses and improve immune function and reduce immunity. In all the varied symptoms that we see in long COVID, there is some either strong evidence of nutrition that can potentially work in COVID, or at least a rationale that within the natural health field and the use of diet and nutritional supplements is far, far safer than its medical counterparts. Now, I'm not saying that someone with long COVID or someone wishing to prevent COVID in the first place or long COVID complications should only consider nutrition, but they certainly should consider nutrition. That is certainly what I'm saying. And again, there is an overwhelming number of nutritional studies in the medical literature that can be found on the Cochrane database, that can be found on the National Library of Medicine website. These are the storehouses for millions upon millions of articles, and with the published medicalarticles.com or the PubMed website, we're talking about articles that date back from approximately 1966 to the present. There are thousands upon thousands of nutritional articles, many of them showing promise in COVID, and now we're also starting to see those studies coming out against long COVID. And strangely, I've had some clients who are concerned that their doctors are not taking their long COVID symptoms seriously, or even the fact that they have a syndrome which has been identified as long COVID. But I need to tell you, we know that long COVID is a very real, tangible syndrome. There is plenty of physiologic and physical evidence that support this long COVID hypothesis. In fact, the evidence is so strong, we simply cannot attribute the number of people complaining of symptoms that can be categorized as long COVID as being merely psychosomatic. Long COVID does seem to be, for now, I'm fairly comfortable saying this, a neurological disorder. But of course, it doesn't only involve the nervous system. It can involve any number of organs in the body and also underlying inflammatory control and immune control. But there certainly are a lot of neurological aspects of long COVID. And many of you have heard about them. You may not even realize it. Do you remember early in COVID, there was talk about the loss of sense of smell in many COVID patients. And they attributed this symptom to COVID infection. And what's important to realize, I'm going to give you just a little bit of neuroanatomy here, that one of the reasons why loss of smell is a central nervous system symptom is because the smell nerves are really not nerves by definition. A nerve by definition is a bundle of neurons, for example, or nerve cells that come off the spine. But the smell nerves are literally brain extension. Sort of imagine a piece of clay in your hands, and if I were to ask you to kind of pull some of that clay out towards you and form kind of a long worm coming off of the big lump of clay, that long worm, if it were to go in your nose, would be your smell nerve, and it's a direct extension of the brain. And when we have loss of sense of smell, we know that we are likely dealing with a central nervous system problem. And the reason why I'm categorizing long COVID as a neurological disorder is because a good number of the symptoms of long COVID seem to be potentially neurological, like brain fog, which involves the brain and mentation, and fatigue. So long COVID is certainly not a psychosomatic or made-up condition in someone's head, as some doctors still seem to think. So what I'm going to do right now is I'm going to kind of jump right into some practical points. I'm going to talk about some nutrients and how they might affect long COVID. Then I'm going to get back into how common long COVID is and what I think is actually the cause or causes of long COVID. I'm going to mention some very important infectious disease studies which support my contentions here in the show. I'm going to talk about the blood clotting problem and how we should combine potential medical treatments along with nutritional treatments for the best potential outcome of those affected with long COVID. Now, if long COVID is caused, and many researchers agree with me about this, in part by a replication or hyperreplication or viral loading effect, where COVID-19 causes an infection, and due to the environment of that particular person, there is viral replication. If the immune system of that person cannot manage to reduce or curtail that viral replication, it continues. That wears out the immune system. It may even trigger various autoimmune processes in the body. But if it isn't, in fact, viral, then it makes sense that certain antiviral medications might be useful here. So before I get to the medication, I want to talk about some nutrients which I believe have a far better side effect profile and health potential overall, because each of these nutritional factors I'm going to mention have potentially profound effects upon your lifespan and your health span. And your health span is that period of time during your life which you live without appreciable symptoms and issues. Probably one of the best examples of nutritional factors that have been proved to reduce viral replication rate, and not just in COVID, by the way, but in many other viral syndromes, is N-acetylcysteine. Now, I did not say cysteine, I said N-acetylcysteine, the acetylated form or activated form of the amino acid cysteine. So briefly, cysteine is antiviral, it's antibacterial, it's antifungal, it's antiparasitic. It is a mucolytic agent. It breaks up mucus. It breaks up mucus so effectively that it extends the life of people with a genetic condition of excessive mucus formation called cystic fibrosis, and extends their life by decades. NAC is also a metal chelator. It binds to toxic metals and brings them out of the body. It's so powerful, NAC, of a detoxifier, that it is the go-to medication for Tylenol toxicity that results, if left untreated in some cases, to liver failure. So NAC, somewhere between 500 and 3,000 milligrams is the ideal dose. Now, of course, I need to give the disclaimer, folks, none of this information is meant to provide you with anything other than education. I'm not giving you medical, nutritional, or any other healthcare advice. You should run by anything that you want to manage on your health with a qualified health professional. So there are nuances to N-acetylcysteine and some of these other nutrients where they may not be my first choice for a particular individual. So that will have to be left to another show. The other factor, nutritional factor, that I think is important for a long COVID or even just corona-19 viral infection is the use of licorice. So I'm talking about licorice because licorice has something called glyceric acid in it. Licorice is very antiviral. In my book on hepatitis C and natural remedies, I talk about how it reduces hepatitis C viral replication and other viral replication rates and improves immunity, reduces inflammation. It's an extremely potent antioxidant. So, but licorice increases potentially cortisol production. And cortisol is a hormone produced by the adrenal glands. And the less cortisol we have, the weaker our adrenal glands, the less able we are to manage all sorts of stressors, whether or not those stressors are viral or emotional or chemical or any of that, or pollutants. So we know in long COVID that the seemingly majority of affected people tend to have low cortisol levels, which means to me that long COVID is a condition which involves the endocrine system, which by definition means hormonal systems. It reduces cortisol. I have also seen and read research articles showing it reduces another very important adrenal hormone known as DHEA, or dihydroepiandrosterone. And it's been known for decades in physiology and neurochemistry and just nutritional biochemistry overall that if an individual has weak adrenal glands, they are literally susceptible to increased risk of all-cause morbidity and mortality. Another antiviral agent is vitamin C. I prefer to use a buffered form of vitamin C that's in a powdered form for a greater and faster uptake into the blood. We know that vitamin C increases leukocyte function and numbers. Leukocytes, that's just a fancy term for the different types of white blood cells, and we want to increase those antiviral cells, especially which are the lymphocytes. Vitamin C is shown to do that. Licorice is shown to do that. N-acetylcysteine has shown to do that. NAC, by the way, if I can just jump back to that for a second, many of you might recall, this stuff works so effectively in COVID. We're talking reducing one's risk of getting COVID in the first place. And if you should get COVID, NAC seems to reduce the viral replication rate in that individual and thus reducing hospitalization potential. And also, NAC seems to reduce time spent in the hospital. And if NAC were taken early enough during the course of COVID-19, it might also help offset one's risk of developing long COVID. So vitamin C, absolutely important. I like to do what's called a vitamin C flush on my patients. You might want to look that up on my website at drmichaelwald.com, the vitamin C flush instructions, and you get an idea of how to properly dose your vitamin C levels. And then there's Echinacea, which we know is antiviral. Garlic is antiviral. Now, these different nutrients, I keep saying antiviral. Well, they work on some of the same mechanisms of antiviral protection in the body, but each of these nutritional compounds also has its own unique ways of working. So it's important that they're given together when that's appropriate in an individual. For example, if I had a patient that had hypertension, I may not want to give them, certainly as my first choice, licorice, because we know that licorice can cause hypertension. It can produce what's called a pseudo hyperaldosterone effect, which raises blood pressure. Now, if someone has low blood pressure, they might be the perfect candidate to give licorice, particularly if they have COVID-19 symptoms and or long COVID symptoms. And of course, vitamin D3, the active form of vitamin D, particularly important. We know that almost every cell in the body has vitamin D receptors, which is why so many doctors these days, no matter what their specialty, they seem to now know about at least vitamin D testing. They're way off from knowing what to do with those vitamin C results. I'll just warn you all. If you should ask your doctor, and this is the typical scenario, the patient asks the doctor, the traditional doctor who doesn't really know much nutrition, to perform a blood or plasma, a vitamin D3 level, and the doctor sometimes will say no, and because they don't know what to do with it. And other times will decide to do it, and then they get an abnormal result, and they really don't know what to do. So the most common advice that I hear these uninformed doctors giving people with vitamin D3 deficiencies, and I'm telling you this, everyone, so you can avoid this problem, is the following. First, they'll say, okay, your vitamin D3 level is low. You need to take vitamin D. Go take some vitamin D. Go buy it in the health food store. And of course, that's ridiculous because you need to know how much vitamin D3, how long you should be taking it. Then the next smartest doctor says, okay, I want you to take vitamin D3, take 200 or 400 IUs, international units. And that, of course, is completely inadequate. The really smart doctor will say, oh, you're vitamin D3 deficient. You need to take 5,000 IUs of vitamin a day. And let me tell you what the correct answer is. If you are clinically low on a blood test in vitamin D3, you're supposed to take 50,000 IUs, this is if you're normal weight, 50,000 IUs of vitamin D3 once per week for 8 weeks. And at the end of the 8 weeks, you check the blood test again because you need to know that you fixed your vitamin D. Now, what does fixed mean? Well, the range of vitamin D is between 30 and 100 from most labs. Most doctors are content if you have a 31. I'm not joking. Or a 35. They'll look you straight in the face and say your vitamin D level is normal. But we know that the higher normal your vitamin D3 level, the lower your overall morbidity and mortality and better the antiviral effects. There seems to be an inverse relationship. Okay, let's move on from D. And of course, there's zinc. Most people know that zinc is somehow connected to immunity. It does increase the activity and sometimes even the numbers of lymphocytic cells, which are antiviral cells. And the zinc needs to be started ASAP. It's shown to reduce morbidity rates for lots of conditions, including COVID-19. Zinc is needed for something over 200 enzymes the last time I checked, having to do with immunity, anti-inflammation, what's known as neuroplasticity or brain tissue repair, or any neurologic repair anywhere in the central nervous system. And by the way, not only is zinc a positive neuroplastic agent, but so is D, so is C, so is N-acetylcysteine. So a lot of these nutrients I'm talking about support neuroplasticity, which again is a term that describes the resiliency of the nervous system to make repairs, but they need the right nutrients. And then we all know that fruits and vegetables are generally speaking healthy for us. They're loaded with polyphenols. These polyphenolic compounds are very strong anti-inflammatory agents. Green tea, for example, and broccoli and cauliflower and any plant is loaded with polyphenolic compounds. So I always put my patients that have any COVID-19 illness on superfoods that I've designed very carefully and dose for each individual based upon their entire clinical picture. What else is important? Well, in long COVID, we see on laboratory work often that the serum potassium level is decreased, and that will tend to cause, in persons with long COVID, high blood pressure. And we think that the COVID-19 virus blocks what's called the ACE2 enzyme system, which results in a drop in potassium in the blood and an increase in blood pressure. So we know that increase in blood pressure is a major factor for reduced morbidity mortality, so something we want to get under control as soon as possible. I'm going to give you a couple of other key nutritional products. Probiotics. The probiotics should have a combination of both the bifidobacteria and the lactobacillus bacteria. And we just know in these studies that people with long COVID and COVID-19, they simply recover faster when they take probiotics. The other really important factor that I find for overall improvement in COVID-19 illness, including long COVID, is the use of protein. So many people have diets that are carbohydrate heavy and fat heavy, but we need to increase our protein, particularly as our first meal of the day. Because during sleep, which is essentially fasting, the body uses up most of its glucose stores. It may get into the glucose stores in the liver, for example, and in the muscles, the glycogen, as it's called. And then it starts eating up the lean mass in the body, which includes many of our organs and our muscles. And we know that the more lean mass a person uses, the higher their risk of dying of anything. Folks, that is not something you should take lightly. Let me repeat it. We know that a reduction in lean body mass is one of the, actually it is the number one biomarker to predict increased risk of dying of anything. That's why a bioimpedance test or a body composition, same thing, which checks, among other things, a person's percentage of muscle, water, fat is very important. I always start with that to figure out, based on the pounds of lean mass on a person, or the kilograms of lean mass on an individual, how much protein they need. Now, we need protein to maintain these proteinaceous tissues, these tissues that are made of protein. Again, a lot of our organs and also our lean muscle mass. But our immune cells, much of our immune system depends on adequate protein nutriture. So if you can't manage healthy and preferably plant-based proteins in your diet, you could take a protein supplement. That protein supplement or protein powder probably should be a combination of pea and rice protein, because those together give you a complete protein. Whey protein is probably my favorite, a grass-fed whey protein to build immunoglobulins and to build lymphocytes, which are a subclass of leukocytes, which are white blood cells. Also, elderberry, that's a very strong antiviral across the board. The need for omega-3 fatty acids. Omega-3 fatty acids form a major component of the fatty portions of the nervous system, because the nervous system, which is predominantly the brain, is made mostly of fats. And the brain can oxidize or break down. And we believe that viruses, including long COVID, are causing problems with the fatty acid concentrations in the brain. So I usually dose my patients pretty high on omega-3 fatty acids, particularly emphasizing the DHA component of the fish oil. So you may be aware that fish oil is sometimes referred to as EPA-DHA. So there's the EPA, the eicosanopentanoic acid part, and the DHA, the docosahexaenoic acid part. And the DHA part is better for neurologic problems, and the EPA part seems to be better for cardiovascular problems. And in long COVID, we have major cardiovascular complications in many of the sufferers. And we certainly have major central nervous system brain issues. So the use of omega-3 fatty acids cannot be overlooked. Not only that, a greater concentration of omega-3 fatty acids in the body helps fight inflammation. The omega-3 fats act as antioxidants. And many, many other neuroplastic agents. I can go on. Another nutritional product to think about with long COVID is medium chain triglycerides. You might know them better as MCT or MCT oil. So the reason why everyone's going coconut crazy about coconuts, and I've always loved coconuts, by the way, is that they are helpful mainly because of their concentration of medium chain triglycerides. But coconut oil is only about 25% or so MCT oil. So I like going right to medium chain triglyceride oil that the person consumes by mouth. Now, medium chain triglycerides provide a fuel, which actually the main fuel for the brain and the entirety of the nervous system to self-repair. Again, there are many other benefits of MCTs as well in terms of reducing clot formation as anti-inflammatory effects and numerous other benefits that may very well mitigate lots of the symptoms we see in long COVID. Now, I should mention, as far as the clotting aspect, which is a very serious problem, these microclots, they might be managed with turmeric. Turmeric, which has been long known in Ayurvedic medicine as a blood purifier, we know is an anti-clotting agent. So it works in various ways. We don't know all the different ways. It may affect the various liver coagulation factors. It may also improve the ability of platelets to unstick themselves and avoid being stuck to one another in the first place. That's called platelet aggregation. A vitamin E, by the way, is also a really good platelet aggregator. That's been known for decades. So imagine combining MCT oil, omega-3, turmeric, and some of these other nutrients that I mentioned, that the potential for averting a catastrophe such as a stroke from microclots from COVID-19, to me, makes it absolutely mandatory that we take the nutritional aspects of long COVID quite seriously. And you'll know if you should read my upcoming book that I mentioned at the beginning of the show, that should be out at some point late in 2024, called Long COVID Natural Treatments. You will find quite a lot of the medical and nutritional references that back up what I'm saying. So we know already that these nutrients can help, and they're generally safe, particularly when they're prescribed by qualified health professionals. Let me spend 60 seconds on what I believe comprises a qualified nutritional perspective. I believe that nutritionist should have a doctorate that allows that practitioner to run laboratory work. Because if you're not running the laboratory work, you can't know that these nutritional supplements are working properly. When I work with patients, I'm running laboratory work, and doing comparative work to see how various doses and combinations of nutrition work for that particular person. Because when it comes to long COVID, it rarely affects given individuals the same way. It has some similarities from person to person, of course. As I mentioned at the beginning of the show, there may be brain fog, there may be cardiovascular complications, there may be a lack of fatigue. But once again, the presentations are very, very varied, which is another reason to use a wide breadth of nutritional supplements to cover as many possible mechanisms of action that COVID-19 virus may be affecting the body in terms of, for example, reducing the immune system, reducing the number of white blood cells, the resiliency of those white blood cells, reducing the body's ability to control inflammation, reducing the nervous system's ability for successful neuroplastic repair. The list goes on and on. And furthermore, I'm going to go so far as to say is that if we don't begin taking long COVID extremely seriously, we are going to be inundated. When I say we, I mean the medical care system in this country will forever be inundated as a serious public threat with a tremendous number of long COVID sufferers. And although it's not a topic of today's show, I'll speak in other shows how the risk of dementia from COVID-19 is thought to be predicted over the next 3 to 5 years to be increased by something like, don't quote me on this, but maybe as much as 25 million cases. I do know it's tens of millions of cases. So let me just kind of back up just a minute. Let me just clarify, what we mean by long COVID. There was a meta-analysis, which is a type of an analysis that involves throwing out a bunch of studies that were not properly performed or had bias or for some reason or another are not reliable, taking the reliable studies and looking at them as a whole. So that's a meta-analysis. And there was a meta-analysis out of the UK published in the magazine Journal at some point, I think was last year, 2022, where they reviewed 9 studies, which included over 1 million COVID cases that were reported in the UK. And they defined long COVID as a syndrome of symptoms that were present in an individual 12 weeks post or 12 weeks after the initial COVID-19 infection. So symptoms post-COVID-19 infection that last for at least 12 weeks are put in the long COVID category. And at least in the UK, they estimate that somewhere between 10 and 30% of people who are infected with COVID-19 will develop long COVID symptoms. That's between 10 and 30%. It could even be higher. Only time will tell. That to me is an incredible wake-up call to act fast. And some vaccine pushers are claiming that, long COVID may become less prevalent over a period of time as more people gain natural immunity. That I certainly believe, and possibly also through immunity through vaccination. But, common sense should tell us that the best way for us to get an infection is through natural exposure, what's known as natural immunity. And in that way, the appropriate physiologic and immunologic capacities of the body come into play, which are not the same as those that come into play when we're getting passive vaccination or inoculations. And furthermore, what has been observed is that when we compare the reports of long COVID during the summer of 2021, where we had that wave of the Delta variant. And then, as I recall, the Omicron virus became the more dominant one in 2022, in the winter of 2022. And what was determined, at least with that observation, is about 10% of long COVID during the Delta dropped to only about 4 to 5%, something in that area, once the Omicron variety took over. So there may or there may not be a difference in long COVID let's say, susceptibility from the different subtypes of COVID-19. But that's going to be very difficult to nail down as well, because the phenomenon of being infected with a virus depends on a number of factors. It depends on the virulence or the strength or veracity of the virus itself relative to the resiliency of the individual who's affected. So given those factors, and there may be other factors, it's going to be hard to say that one subtype of COVID-19 virus is necessarily going to create more of a susceptibility to long COVID than another. And this brings us to the question, why do some people develop long COVID symptoms and others don't? And why do some people develop long COVID symptoms that are life-altering to the point where people are going on disability? And some have minor symptoms and are able to carry on with the rest of their lives. I mean, we're talking of more than 100 million Americans that have been affected with COVID-19. So COVID-19 is literally ubiquitous. It is everywhere. And I think that one of the final determinants of whether or not an individual will fall prey to COVID-19 is their innate immunoresiliency factors, which are very much determined in large measure by the foods we eat, the nutrients that we absorb from these foods, and the resultant immune resiliency, as I mentioned, ability to control inflammation, and neuroplastic repair. And these are the three major areas where nutritional supplementation in the form of foods and nutritional supplements like vitamins and minerals and phytonutrients in the form of liquids or powders or capsules or tablets should be very, very strongly considered. But we do know a couple of things. We know that if you're older and you have various comorbid conditions, we've all heard this, that you are in poor health, obviously, and you are at much higher rate of not only being affected with COVID-19 in the first place, but your chances of getting COVID-19 is far greater than younger people with fewer comorbid conditions. And, these susceptible individuals, I believe that some of them simply do not fully manage the viral replication. They don't fully eliminate the virus from the body. And that's what's known as viral persistence. And again, the virus will thrive in a nutritionally poor environment. It'll thrive in an oxygen poor environment. It'll thrive in an environment where there is reduced adrenal function or adrenal insufficiency. I like to call it adrenal fatigue. Now, I do want to say one thing about this adrenal thing, because if you go to a regular doctor, and especially if you go to a hormone specialist, an endocrinologist, and you say to that doctor, look, I have long COVID, everyone agrees, and I believe I have adrenal insufficiency, they will check the various hormones of your adrenal gland, and they might be normal, but they might be on the low end of normal. Or they might be abnormally low, but not to the extent that meets the medical criteria and definition of adrenal insufficiency. So in nutritional medicine, we use the term adrenal insufficiency to mean a weak adrenal gland that might look like the worst medical adrenal insufficiency problem, which is known as Addison's disease or low adrenal function. And by the way, Cushing's disease is the opposite of that. That's hyperadrenal function. And as I mentioned earlier, we do seem to find clinically low cortisol levels in persons with long COVID. So these sorts of tests for cortisol, for example, for the adrenal hormone DHEA, possibly aldosterone, these are part of an important long COVID workup in most people. And from a traditional medical perspective, we know that there may be the telltale spike protein that is found in the serum or the blood 12 months post COVID-19 initial infection. And some people have this spike protein for the rest of their lives. And then other individuals have that spike protein along with long COVID symptoms. So we get a mishmash of different expressions in different people. And that is due to what's known as viral persistence, how the virus just lingers and starts degenerating things. And one particularly morbid discovery was that some research, which was autopsy-based, which appeared in the journal Nature in 2022, in the December edition, found the COVID-19 virus literally everywhere, all over the body, even months after initial infection. So it occurs to me that the symptoms or the symptom expression of an individual when they're infected will vary depending on what tissues, organs, cells, organ systems in the body are affected. Obviously, if COVID-19 affects the lining around the heart, we're going to get pericarditis. The person can have difficulty breathing. It can be a life-threatening problem. Again, if the coronavirus affects possibly the liver coagulation pathways, then the person might develop microclotting. So I'll give you one last example. If the virus likes to or prefers to take up residence in the muscles, then you might have muscle aches and fatigue. So you can see that the list of symptoms can grow. And someone might have a particular symptom like fatigue, where in one person it might be because of adrenal fatigue, and another individual because the hormonal systems are affected in a person with COVID-19 or long COVID, such that they drop the blood sugar. Other effects of long COVID might be brain inflammation. So again, the same symptom can result from different underlying mechanisms. And that's where a skilled practitioner who is trained in nutrition, who also has license to draw laboratory work, is, I think, the best choice. You might want to consult my website at drmichaelwald.com. That's drmichaelwald.com. And in the search tab, search for how does a person choose the most qualified healthcare provider for their particular concerns. We just don't have the time to cover that here. But not only is the coronavirus in the form of long COVID a problem in all of the ways we've described, and this we've known in infectious disease for decades, again, is that any virus, by taxing or weakening the immune system, can trigger the reactivation of many other infections, and not just viruses, fungal infections, bacterial infections, even parasitic infections, by weakening the resiliency of the body. And along with these reduced immune effects, in many long COVID sufferers, they have an increased risk of a heart attack and stroke that they might experience many, many months after the infection. And these so-called microclots are being produced, which again we don't know why they're being produced, but I think if we nutritionally assume that the liver coagulation factors are being affected, along with the platelets that may be developing within the bone marrow, which is where they normally develop, and also those in circulation, inflammation, all of these factors promoting microclots, that the nutrition, again, is the safest way to go. Now, however, if you have an emergency situation where you have, for example, a pulmonary infarction or death of some of the lung tissue due to a microclot that has gone from one part of your body into your lungs, this is a medical emergency. You don't stay home and swig down a bunch of fish oil and turmeric. It's not going to work. You need to be hospitalized immediately and treated with anticoagulants. And by the way, some people are lucky. They'll get microclots. They'll never know about them, and they'll disappear all on their own. The body does have a capacity to manage some of these side effects. So it really depends on the individual's resiliency or ability to recover against the virus that determines their overall outcome. And in those individuals who do not have the transient clots, the ones that go away by themselves, but have persistent clots, those are the ones who I believe need to be on the right nutrition. But if your doctor, and it's usually going to be your hematologist, oncologist, who is the one with most of the expertise in knowing how to manage clotting problems, because the anti-clotting medication is far from perfect. It doesn't always work. But my point is that if you are on an anticoagulant medication or a combination of medications by your doctor, you need to let them know all of the nutritional supplements that you're taking. Now, the regular physicians who prescribe anticoagulants, they may not understand nutrition at all. So they're going to tell you, stop taking any nutrition, and you might need to do that. I would never suggest that you should go against your medical doctor's advice, but you should put your nutritionist or your nutritional doctor in communication with your regular doctor who is prescribing the anticoagulant therapy, so that you can work together for the benefit of the patient. That means you, hopefully not you who's listening, but obviously this information we're presenting today is useful for anyone that has a concern over the risk of developing long COVID. And certainly if you have any of the symptoms that we've discussed in today's show, you might be more susceptible to those symptoms being triggered in a long COVID. And, regarding the whole nutritional aspect of things and healthy lifestyle, which I know deserves some definition. In other words, healthy lifestyle, what that might mean for each person is something that I certainly must determine with each person. But the point here now is that we have this nutrition that can potentially work before things get worse in an individual, because COVID-19 and long COVID is still a medical and worldwide disaster. We have tons of individuals that are being infected as we speak. Infection rates are increasing all the time, and that means we're increasing the population's percentage of individuals that are susceptible to developing long COVID. So whether it's traditional medicine or nutritional healthcare or medicine, if the practitioner believes that viral replication is the predominant problem driving long COVID, then it makes sense that they might want to consider prescribing an antiviral medication like Paxlovid. And there is some evidence starting to come out that it may help to reduce viral persistence. But we also know that N-acetylcysteine can do that. And elderberry, for example, vitamin C, zinc, vitamin D, resveratrol, many, many different choices. And at least we may want to complement the Paxlovid. So that means you would have to visit a qualified nutritional healthcare provider that knows about medical, or I should say medicine or drug nutrition interactions, both the positive interactions between, let's say in this case, an antiviral drug like Paxlovid, and can that be used with N-acetylcysteine in a given person, or any of the other supplements. That always needs to be considered for each person, because one thing I can tell you is the mechanisms and ways in which long COVID affects individuals are multifaceted. There's many different ways that individuals can be affected. And I mentioned some of them, over and over again, I'm reiterating, but some have more of a cardiovascular presentation. Some have more of a central nervous system presentation. Others have more of a hormonal deficiency presentation. Others have a combination of those, and then all other kinds of wacky symptoms. Again, viruses can affect or sequestrate, hide in, replicate in virtually any place in the body. Another medication that has shown some promise in long COVID, and there was a paper recently about this, was found in, is a diabetic medication, essentially. It's known as metformin. And metformin's been around a long time. It is used to improve insulin resistance by improving insulin's receptivity and its ability to manage blood sugar. It's also an anti-inflammatory. And researchers at Harvard and other places have been studying metformin and believe it may be a longevity or anti-aging approach. And I am one who has looked at the research on metformin and from an anti-aging perspective, and I'm so impressed with it that I take metformin myself. And I'm a natural guy, but I am not so ignorant as to ignore the potential of a relatively safe medication for me. I can't speak for others, that seems to reduce the risk of one developing long COVID. And metformin, although it's a diabetic medication meant to lower blood sugar in diabetics, doesn't work that way in long COVID patients, it's thought. It works, again, by probably affecting or reducing the viral replication rate of COVID-19. But of course, if an individual has, let's say, pre-diabetes and is not on metformin, but also is at high risk of developing long COVID, metformin would be a very, very good consideration, medically speaking. And from a nutritional perspective, so would vitamin C. The structure of vitamin C, the actual molecular compound, is very similar to sugar. So vitamin C can actually block sugar uptake in the body, effectively working like an anti-diabetic medication. But probably even more important than vitamin C, for individuals who are concerned or have long COVID, who have blood sugar problems or the early manifestations of blood sugar problems, known as prediabetes, might want to consider the B vitamin, alpha lipoic acid. Now, alpha lipoic acid is a very special natural factor. And I say that because throughout I would say, nearly 30 years that I've been using alpha lipoic acid in my patients, it's been shown to reduce blood sugar dramatically. And I've seen that on clients. I would even say it reduces blood sugar more safely than metformin and just as effectively. And if you want to know if this is true for you, let's say you're a diabetic, you're on metformin, you want to change to lipoic acid, talk to your doctor about it. If your doctor doesn't know about lipoic acid, find a doctor of nutrition that can draw lab work and have those two doctors speak with each other so they can develop a plan to see whether or not you're a good candidate. And the only way to determine that is to slowly reduce your intake of metformin and to increase your intake of alpha lipoic acid. If you just add the alpha lipoic acid to your metformin, you might get yourself into a hypoglycemic or very, very low blood sugar situation that could land you up in a hospital or even in a coma. So obviously, folks, that is a lot to think about in terms of long COVID. And I most likely will be doing some follow-ups on this show. That'll depend on your feedback. But what did we cover today? We talked about what long COVID was. We discussed that there are over 200 distinct varied symptoms in long COVID sufferers. Some get more cardiovascular complaints. Others get more neurologic complaints. Others have complaints that involve their lungs. Others may involve their liver function and or their renal systems. The list can go on and on. Why? Because viruses can replicate anywhere in the body, and depending on the organs affected by the viral load and the viral persistence and the viral resistance, we get our various constellation of symptoms in an individual. I also reviewed some of the key nutritional factors, which I thought, and I really believe are the main foundation of the nutritional treatments. I might work with an individual who I recommend half of these nutrients for, and some I might recommend all of them. It depends on a lot of factors. What medications the individual's on, what are the symptoms that the person's showing, what is their diet like, and what are their comorbid conditions, such that I might choose not to use N-acetylcysteine, and I might want vitamin C and Echinacea instead. There may be specific times I might emphasize vitamin D over zinc and polyphenols. Again, it's impossible to say, but at least you want to search for a practitioner that is knowledgeable of both the nutritional approaches to long COVID and the medical approaches. Thank you so much for listening to today's episode of Ask the Blood Detective. My name is Dr. Michael Wald. Certainly reach out to me, send me an email, let me know your questions, comments, and show ideas at info@blooddetective.com. You can call me at 914-552-1442. And I just love giving away all this great information, this videos, this free content up on my website. You can just search the search bar, and that's at drmichaelwald.com. That's drmichaelwald.com. Speak to you next time, everybody. Please stay safe.